The next item of business is consideration of business motion 20066 in the name of Graham Day on behalf of the Parliamentary Bureau on changes to business. Any member who wishes to speak to the motion should press their request to speak button now. And I call on Graham Day to move the motion.
Move, Presiding Officer.
Thank you, Minister. No member has asked to speak to the motion. Therefore, the question is that motion 20066 be agreed. Are we all agreed? The motion is therefore agreed. The next item of business is topical questions, and at question number 1, I call Carol Mockin.
Thank you, Presiding Officer. To ask the Scottish Government, in light of NHS Ayrshire and Arran suspending routine hospital visits due to a sharp increase in flu cases, whether it will provide an update on the action that it is taking to support NHS boards in relation to increasing winter pressures.
Cabinet Secretary Neil Gray.
Presiding Officer, I am aware of the significant pressures the NHS is and its staff, whom I am incredibly grateful to, are under over the winter period. And I was clear in the statement I gave to Parliament last month of the steps we have been taking since last winter to improve our resilience this year. This includes additional support to NHS 24, the Scottish Ambulance Service, as well as providing up to £20 million investment to support social care and front door pressures to improve flow. Furthermore, initiatives taken forward by the Scottish Ambulance Service, like the Hospital Ambulance Liaison Officer at the front door of our hospitals, are designed to relieve pressure on acute services. Experts in Public Health Scotland and the Scottish Government are closely monitoring the flu situation, and vaccination remains our best protection against the virus. This, alongside enhanced infection prevention control measures, aims to support boards to manage with the increase in respiratory infections over this winter.
Carol Mockin.
Thank you. Can I thank the Cabinet Secretary for that answer? As the Cabinet Secretary outlined in his answer, vaccinations are the best way of protecting oneself from flu. Last year we did have a poorer uptake, so why this year has uptake been so low? There are over 300,000 fewer adults vaccinated now compared to 2 years ago, with children's vaccination rates down, and some areas had delays in administering vaccinations. Public Health Scotland has reported that all age groups are now affected at levels not previously seen at this time of year, and confirmed cases of flu in Scotland have more than doubled in the past week. Cabinet Secretary, as you said, prevention is key, so why were there delays to administering vaccinations, and why are vaccination rates significantly lower compared to 2 years ago?
Cabinet Secretary.
I thank Carol Mockin for her question, and I reiterate the point that she has made on the importance of vaccination, and anybody who is eligible, whether staff or patient, should be picking up their vaccinations. The best way of protecting themselves, their family, their colleagues and services this winter. The JCVI recommended groups for flu vaccinations changed this year, so when we actually compare like for like, particularly amongst adults, we are actually ahead of where we were last year in terms of vaccine uptake. There is much more to be done, and I want to encourage people to continue to take up the vaccine. We've delivered over 1.5 million vaccines so far this year. The vaccine programme started upon delivery of the vaccine supply in September, and we continue to push the message that is so important that I hope will leave the Chamber today resoundingly, which is please take up the vaccine.
Carol Mockin.
Thank you, Cabinet Secretary. Health boards across the country are facing a sharp increase in cases, with hospital admissions due to flu increasing by 70%. NHS Ayrshire and Arran have been forced to suspend routine visits across all hospitals. Some hospital wards in Dumfries and Galloway have closed to new admissions, and Glasgow Health Board has told patients with flu symptoms to stay at home and treat themselves. So the situation is worsening. Can the Cabinet Secretary please advise what support he has put in place to support staff dealing with during this early and very sharp rise in cases?
Cabinet Secretary.
Thank Carol Mockin. My absolute gratitude, and I'm sure that of the whole Chamber, is to the work that has been delivered under significant pressure by our health and social care staff. They deliver remarkable care and service to the people we seek to serve all year round, but the sacrifice that they make, particularly at this time of year, is certainly grateful. I'm grateful for, and I know other colleagues will be as well. The uptick in The flu rates this winter is following a similar trajectory, albeit slightly earlier in the year, as it did last year, where we saw significant disruption. And I've already set out some of the measures we're taking in order to improve performance and flow through the system, but there are wider investments that the government has made in terms of supporting the well-being of our staff in order to support them at particular times of pressure such as this, so that they can continue delivering the remarkable care and treatment that they do for the people of Scotland.
Brian Whittle.
Thank you, Presiding Officer. As the Cabinet Secretary is aware, NHS Ayrshire and Arran is under extreme financial pressure, in no small part due to the high levels of expensive agency staff. Given the high prevalence of flu cases will inevitably put greater pressure on staff numbers through sickness absence, has the Cabinet Secretary considered the possibility of emergency financial support to the Board to prevent high levels of staff absence making a bad situation worse?
Cabinet Secretary.
To support all boards all year round in terms of their resilience, and I note, as Brian Whittle will, the substantial reduction in the utilisation of agency staff that there has been across the NHS over the last couple of years. It's better for our staffing establishment, it provides better continuity of care, but there are times of peak demand where the use of agency and locum staff is clearly important, and we continue to have conversations with all boards around their pressures this winter. I'm standing up the World Winter Resilience meetings that were held last year through Christmas and New Year this week, and I expect conversations on that type of area on their resilience and ability to respond to come through in those discussions.
Katie Clark.
Scotland is experiencing what is said to be the worst flu death season in over 4 decades, and changes to vaccine eligibility that the Cabinet Secretary has already referred to has meant that an additional 500,000 people were not offered the flu vaccine. So is the Scottish Government considering eligibility again, and whether eligibility should be extended to those aged 50 to 64?
Cabinet Secretary.
It's difficult to say for certain what this flu season will end up looking like, but the trajectories at the moment are following the very same path as came about last year, where we saw an unprecedented level of flu within the system, and that caused clear disruption to patients and to the system. In terms of vaccination, we take our advice on a UK-wide basis from the Joint Committee on Vaccines and Immunisation. They are the experts, and we follow that advice, as we have done this year in terms of the most effective use of the vaccine, but I would reiterate for anyone that is eligible to make sure that they are taking up the vaccine, because there is still more in terms of the eligible groups that could be taking up the vaccine, that could help for themselves, their families, loved ones, their colleagues and health systems, and I know that health boards are doing all they can to make that as available as possible, including for staff of health and social care services, with drop-in clinics and peer-to-peer vaccination happening as well.
Jamie Green.
Thank you, Presiding Officer. 3/4 of NHS staff in Ayrshire and Arran report to be working in conditions that are so short-staffed that they believe that patient safety has been put at risk. Now, this is a major concern, because if staff now go sick due to flu or other viruses, then the pressure on A&E, for example, will be immense. Now, if staff themselves do not believe that they can deliver adequate levels of care to their patients, and that was before the current flu pandemic took wave, then what is it going to look like in January, February this year? What is the Scottish Government doing to ensure all our NHS boards are appropriately staffed during the winter season? Because this has been a long time coming, Cabinet Secretary.
Cabinet Secretary.
So the staffing establishment and safe staffing levels are there under legislation, and we support boards to ensure that they have the requisite staffing establishment, although I absolutely take the point that Mr Green is making around the pressures that there are on staff, particularly at this time of year. I've set out in my response to the initial question from Carol Mochan some of those areas that we're investing in order to reduce demand and to suppress the demand, particularly upon accident emergency and our acute system, which is particularly pressured at this time. And that includes the investment we've made in general practice, it includes the increased investment going through social care, it includes the upskilling and the upstaffing of NHS 24 in the ambulance service to ensure that we are providing the best possible resilience to the whole system, so that those pressures that have been felt, that Jamie Green is narrating, that have been felt within our hospital settings, are suppressed as best as possible.
Karen Dowie.
Presiding Officer, it's alarming that our hospitals are so stretched that they're having to deprive people of family visits at their time of need. because they're petrified of a routine winter flu taking them beyond breaking point. But can I ask the Cabinet Secretary what assessments have been made of whether the flu vaccination uptake by NHS staff is sufficient, and what additional steps will be taken to strengthen resilience across all NHS boards this winter?
Cabinet Secretary.
Allegations that Sharon Dowie mentions around restricting visitation is not. These are not decisions that are taken lightly. They're not unprecedented either. There's a very difficult balancing act that local teams will be needing to make around risk and the potential impact that that can have on families and loved ones, which everybody will be well aware of. In terms of the vaccination programme I've already set out, there is more work to do, and I believe particularly amongst our staff groups, where I know our boards are doing what they can to provide drop-in clinics, peer-to-peer vaccinations. It is the best way of protecting yourself, your colleagues, your loved ones at this time of year, and I would encourage anyone, regardless of whether they're staff in health and social care or indeed members of the public, if you're eligible for a vaccine, please take the opportunity as soon as possible.
Question number 2, Edward Mountain.
Thank you very much, Presiding Officer. And I'd like to refer members to my register of interests, which declares that I'm a proprietor of salmon fishings on the River Spey. I'm a member of the Spey Fishery Board and a member of Fisheries Management Scotland. To ask the Scottish Government what action it is taking in response to the newly published October mortality figures for the salmon farming industry.
Cabinet Secretary Mary Goujon.
Edward Mountain refers to data published by Salmon Scotland and not by the Scottish Government. Salmon Scotland stated that these figures represent isolated events, with overall survival rates remaining high at around 98.5% per month. Fish farming is highly regulated. Reasons for fish mortalities are complex and vary significantly between sites and incidents. Nonetheless, we expect producers to manage mortalities to the lowest possible levels, and we support the sector in this regard through our support of the Sustainable Aquaculture Innovation Centre, which enables research and development of innovative solutions to challenges that are being faced by the sector.
Edward Mountain.
And I thank the Cabinet Secretary for that answer. It doesn't help this year that the industry has changed the way it reports fish mortality. What we know is that more farm salmon will die in Scotland this year than last year. Does the Cabinet Secretary share my deep concern about this, especially when one fish farm had a monthly mortality rate of 45.2%, with over 600,000 fish dying since the end of September?
Cabinet Secretary.
I think the member raises an important point, and I hope that I've been equally clear in my initial response that we would be expecting our producers to be driving down mortalities to the lowest possible levels. Now, I realised that this was an area of interest with the Rural Affairs and Islands Committee, who undertook an inquiry in relation to this, and there were a number of recommendations that stemmed from their report and a number of commitments that the Scottish Government made in response to that. Because I do think it's also important to highlight that while Edward Mountain has chosen his question today reflects one set of data that is published in relation to mortality figures, there are a number of different sources, and we collect a number of different pieces of information for a number of different reporting matters. So I think it's important that when we're comparing figures, that we look at the overall analysis, such as the survival to harvest, which is part of the fish farm production survey that the Scottish Government publishes each year.
Edward Mountain.
Cabinet Secretary for that answer, but I think even the Cabinet Secretary will agree with me when I say the optics don't look good. The industry is under the spotlight for increasing mortality. And, Presiding Officer, while I'm threatened with legal action by the Chief Executive of the body representing the farm salmon sector for highlighting the industry's failures, the Cabinet Secretary has been twice entertained at international rugby matches by them. Can the Cabinet Secretary confirm that she shares my concern that over 10 million salmon will have died in the first 10 months of this year so far? And will she therefore implement all the REC Committee recommendations in their 2018 report, and specifically recommendation 9?
Cabinet Secretary.
There are a number of points in Edward Mountain's question there. I think, first of all, he will be aware that the committee undertook a follow-up inquiry on the back of the work that had been done in 2018. Now, we have published our response to that in full in terms of the recommendations and all the work that we're taking forward as part of that and the commitments that I've made. I published a response to the committee to follow up on that work, outlining what steps had been undertaken in September, and I'm due to provide another follow-up to committee to update them on progress progress in March. But I do think it is really important to highlight, though, that when we're talking about mortality, again, we would expect that to be driven to the lowest possible levels. It is within no one's interest for there to be high mortalities or for these mortality events to take place. But also, we do have to recognise that sometimes these incidents and events are completely out with the hands of the fish farmers themselves, whether that's from changing climatic conditions, micro jellyfish, algal blooms that cannot always be predicted, which is why the investment that we make in innovation is so critical to ensure that we get ahead of these challenges and drive down mortality to the lowest possible levels.
Thank you. There's much interest in this question. Concise questions and responses appreciated. I call Alistair Allen.
As we rightly consider these figures, does the Cabinet Secretary agree we also have a responsibility to ensure that we recognise how economically important salmon farming is to the Highlands and Islands, not least in my own constituency?
Cabinet Secretary.
Alistair Allen raises a hugely important point there. Where we see salmon farming businesses, they're in the most rural parts of Scotland. There are many of our island communities as well, where they support employment and provide well-paid jobs. And I think just as an indicator of that, and just as some of the value, considering Alistair Allen's constituency in the area he represents, that produced over 40,000 tonnes of salmon for export, worth around £276 million, and nearly 200 people employed in the industry as well. But when you look to the wider supply chain, there is about 11,000 jobs as part of that, and exports worth about £1.3 billion. So this is a hugely important industry to Scotland and our wider economy.
Thank you. Rhoda Grant.
Thank you, Presiding Officer. Apologies. Can you hear me?
Can indeed hear you, Ms Grant.
Thank you. Can I ask the Cabinet Secretary what they are doing to support the industry by way of ensuring that research and development is carried out? Because we see with climate change more of those threats emerging, and we need to anticipate these events and support the industry where possible before they occur.
Cabinet Secretary.
I couldn't agree more with the point that's been raised by Rhoda Grant. As I tried to outline earlier, it's important to recognise that with the changing climate, we're facing new threats and challenges all the time, so that investment in innovation is so hugely important. Now, there is some work that's been funded through the Marine Fund Scotland, but we also provide funding for the Scottish Aquaculture Innovation Centre, because, again, trying to get ahead of these challenges, predicting what's coming further down the line and addressing that is what's going to be so important into the future.
Thank you. Beatrice Wishart.
Thank you, Presiding Officer. Does the Cabinet Secretary recognise the investment by the salmon farming industry and the improvement trend in survival rates, as well as the hard work of the men and women working on the farms every day to produce the UK's top food, with exports expected to reach £1 billion this year?
Cabinet Secretary.
I absolutely do recognise that, and I think that was one thing that stuck out to me, I think, when the committee was taking evidence and undertaking its inquiry, was just to hear from the fish farmers themselves, who are working really hard to produce that high-quality source of protein that, as I've outlined, is so important for our wider economy. And that's the thing, as much as I've outlined in previous responses about the investment that we're putting into that innovation and ensuring we're ahead of some of the emerging challenges, it's also important to recognise the huge sums of investment that the industry is putting in themselves to try and tackle and address some of the challenges that they know they face too.
Thank you. Ariane Burgess.
Given that in mass mortality events at Gobna Howe and Portree, both in Skye, the government did not know the real numbers of fish deaths as they happened, because Scotland's mortality figures exclude early deaths, cleaner fish, culls and transport losses. This has allowed companies like Bakkafrost to report 0 early deaths at Portree to regulators, while telling investors that 19% of their fish died in the first weeks at sea, with nearly 4 in every 10 farm salmon placed in cages dying. Will the Cabinet Secretary accept that this is not credible regulation and commit to closing these reporting loopholes so that every farmed fish death is counted in real time?
Cabinet Secretary.
First of all, I want to outline that we have a really robust regulatory regime when it comes to finfish aquaculture in Scotland. And in terms of the data that is produced, I outlined in a previous response to a question just the number of different reporting mechanisms that we have. And we collect that information for a variety of different purposes. One of the key recommendations that came through the committee was about how we transmit that data and how we can make that more easily accessible for people and more transparent. So a number of pieces of work have been undertaken in that regard. But I think, again, I can only reiterate what I've said in previous responses about mortalities. Now, we want to ensure that these are driven down to the lowest possible levels. We undertook and have made a commitment to do pieces of work in relation to this in response to the committee's recommendations, and I'm determined to continue that work.
And Alec Rowley.
Presiding Officer, surely the Scottish Government must be concerned about the increasing levels of disease within the salmon industry, especially given that the committee report from earlier this year's finding that slow progress was being made on regulation. Does the Cabinet Secretary recognise the damage this continues to do to national and international reputation of Scottish salmon?
Cabinet Secretary.
Again, I can only reiterate what I've said in previous responses in relation to that. Again, we want to ensure that mortality is driven down to the lowest possible levels. It's within all of our interests that that happens, both from a government perspective, from an industry perspective too, which is why that investment that we've talked about in innovation is so critical. And again, I would point back to that when we're talking about mortalities and some of the events that we've seen, again, a lot of that can be completely out with the control of the fish farm itself because of the changing climatic conditions that we see. So I just think it is really important that we bear all of that in mind when we look at some of these figures. And I think we can also pick out figures from month to month, but it's also important to note that that can be variable, and there have been, as I outlined in my initial response to Edward Mountain, increasing survival rates too. So we need to look at that across the whole of the cycle. But there is a lot of work going on in relation to this. We've responded to the Rural Affairs Committee recommendations with a number of commitments, and I followed up with the committee as well to outline our progress against what we said we would do, and that work very much continues.